There's always the interplay between the private and the public healthcare sectors in South Africa. It's needing to establish a fair playing field for that for providers such as hospitals. It's key to ensuring that that system works. So we're joined now in Cape Town by Andrew Street, who's Director of the Economics of Social and Healthcare Research at the University of York. And good morning to you, Andrew. We've got, no doubt you've heard all about our proposed National Health Insurance, NHI. It's a big project. It's going to take a long time to implement. There are pilot schemes at the moment, but whether it's implemented and to what extent it's implemented depends entirely on cost, and in fact our system now depends on cost control. So your sense of where we are with that?
Well, I think you do indeed need to make sure that you have a sustainable healthcare system with a good primary care sector, and that the hospital sector is used as well as it possibly can be. You have a very important private healthcare sector and a public healthcare sector, and it's really important that your hospitals in both the public sector and the private sector are paid fairly for the work that they undertake. The government and the insurance companies need to make sure that they are paying a fair price and a reasonable price for hospital care, and it's going to be important that you design a system that ensures that you're paying fairly, so that hospitals are paying the right amount of, being paid the right amount of money for the care that they provide, and that the system is affordable, so that insurance companies and the government are not paying over the odds to hospitals.
From your experience, Andrew, and I think it's very difficult to measure these things, how do you ensure that the costs are appropriate? Very difficult in an emotional area like health to talk about cost cuts.
Yeah.
And of course, from your experience of the national health in England, in the UK, it's very easy for those costs to spiral. So what are some of the tricks that you've learned that we need to apply here?
Well, you can't just take the price charged by the hospital and say, well, that's reasonable. Of course, if you buy anything in a supermarket, or if you're looking for a different insurance deal as an individual, you'll do some price comparisons before you pick the best price for any type of service. The hospital sector needs to be thought of in exactly the same way. If you're going to be paying for somebody's hip replacement or for an appendectomy or any type of care, it's important that you have some information about what prices might be charged in other hospitals, and basically to make comparisons across different hospitals providing care, so that you can make a judgment about whether the price you're facing is correct. So it's about comparisons. Of course, some of the prices that will be charged will depend on the type of hospital itself. And again, there might be some costs that hospitals incur that are outside of their control. So again, in terms of the comparison, it's important to take those things into account. But essentially, if you're not making comparisons, it's going to be very difficult to make sure that you are paying the right price for the hospital care that you are funding.
Andrew, it's Gugu here. You mentioned there that pricing comparison is something that's very important, but in South Africa we find that private healthcare is it's good, but it's quite expensive, and on the other hand, public healthcare itself is not too good and comes at no price. How do you bridge that divide to ensure that there's this middle class that can have some kind of access to appropriate and affordable healthcare?
Yeah. You're spending in South Africa about the same proportion of your GDP on healthcare as we are in the UK. So we spend about 8% of GDP on healthcare, as you do here. And in the UK, we have full coverage for everyone in a public healthcare system. In the United States, in comparison, 40 million people are underinsured, and but even so, they are spending 17% of their GDP on healthcare. So if you don't get a control of the hospital costs and the healthcare costs generally, you could end up with a system that is extremely expensive. So there are a whole host of tricks that you need to sort out to be able to ensure that you have adequate coverage for the population as a whole. One of those is, of course, to ensure that you have a good primary care sector. That is what the UK's national health system is based on. We have great primary care, which ensures that everybody gets good access to health care when they need it, and that referrals to the hospital sector are managed and appropriate. And I think you really do need to make sure that you have a good primary care sector here.
I think maybe, Andrew, that's at the heart of one of our problems, is that the hospitals, and the teaching hospitals in particular, get overwhelmed. In theory, we have competition. Right. So you've got 2 or 3 major hospital groups. You've got several medical aids, although one player, Discovery, dominates that, and you've got pharmaceutical companies. That's the kind of triangle, and they each have to deal with each other. In theory, competition should drive prices down, but it doesn't seem to have, and healthcare inflation year by year just roars on.
That's right. The competition does help, but there isn't much competition in any healthcare system, because often hospitals are serving local communities, and the effective competition they face isn't very great. So in the absence of effective competition, there needs to be a system of management and price comparison so that the insurance companies or the government are clear about what they are prepared to pay. Essentially, there needs to be some bargaining between the hospital sector and the government in terms of price control, because you can't rely on competition to do that by itself. So with price comparisons and price setting, with fair prices being set in negotiation between the purchasers, the government or insurance companies, and the hospital sector, you can move towards an equivalent of a competitive system, but through a system of managed prices.
Andrew, I've got a media release here in which you also stated that transparency is the cornerstone of good governance. Would you say that you're seeing enough of that in the South African market?
I think that could be improved. I mean, most healthcare systems have great data sharing arrangements. Certainly in the UK, we have really good information flows between the hospital and the government, which pays for our healthcare system. So it's very clear the type of activities that hospitals are undertaking, the number of patients they're treating, the type of patients they're treating, and the costs associated with that treatment. And that allows government in the UK to ensure that the policies that they introduced are based on data, are based on evidence. And if you do not have great data about what hospitals are doing, the activities they undertake, and the costs associated with that, it's very difficult to ensure that you have evidence-based policy making. So I think data and transparency are really important cornerstones for good governance and good policy and good monitoring of the healthcare system. So that's something I think you really need to build on.